Hello guys, today we're going to be taping the elbow. In particular, what we're going to be teaching you how to do is to prevent elbow extension and or hyperextension. Most often we see patients who want to avoid that motion after they've fallen on an outstretched hand and suffered a hyperextension moment. But I've also seen tennis athletes who also may need this to avoid some type of like tennis elbow irritation because going into extension causes a lot of pain. So what we do with this particular tape job is we place the patient in about 15 to 30 degrees of elbow flexion. So we want to put the patient in a flex position. The next thing that I have the patient do is grip a roll of tape or a roll of pre-wrap. And just like with the ankle stepping on or the Achilles stepping on a roll of tape, it's going to allow those muscles to contract with the idea that then we avoid making it so tight that the patient starts to cramp. So as with any good tape job, we're going to spray that patient down, make sure they're extremely sticky. And then the next thing that we want to do is to pre-wrap. Now, I'm teaching you guys pre-wrap, but there are some patients who love to be taped to the skin. So if that is your patient's preference, it is actually the best thing to do. We know about pre-wrap is once it gets sweaty, it gets heavy, it gets thicker, and so it makes your tape job a lot looser. So as you can see, I've applied the pre-wrap from proximal to distal. In terms of proximal point of starting, it'd be about mid biceps, and then in terms of distal ending, about mid forearm. Again, it's going to depend on the length of the actual elbow. So with that said, I'm going to start with 2 anchor strips proximally. And then I'm going to finish with 2 anchor strips distally. And then if we want to prevent elbow hyperextension, what I'm going to do is measure off 3 strips of tape of the same length. With the first strip being laid down centrally. Second strip of tape going from one side to the other. Last strip of tape doing the opposite. And then, of course, like any other good tape job, we're going to end by closing off with our anchors. So if Taylor wants to extend, go ahead and extend. She cannot. What we also do to kind of make this tape job look prettier, as you can tell it kind of gets wrinkled as they start to move, is we'll do a lot of stretchy tape over the tape job just to prevent slippage. But this would be a tape job to prevent elbow hyperextension. If for some reason we have a patient with a UCL sprain, then essentially what we would do is shift that tape job to the medial side of the elbow. So it would look something more like this, okay? So the check rein would just be more medially.